Hello, everybody. My name is Adi, and thank you for having me. I kindly want to start with telling you that today, I'm from Israel, and today it's Israeli Memorial Day. So my heart now is with Israel and with all the soldiers who lost their lives and our hostages that still held in captivity in Hamas tunnels in Gaza. So please, let's pray for their quick release and for their release. So, as I said, my name is Adi Rosenfeld. I'm a cannabis lawyer with Herzog. It's one of the biggest law firms in Israel. I established the cannabis desk about 7 years ago, and we represent clients from across the entire value chain. And I want to tell you that I'm here for 3 days, and everybody is talking about the third wave. Have you heard about it? So the first wave was Canada, the second wave was United States, and the third wave, you want to guess? Europe. So maybe Europe will be the one to set the next pace, global pace. So I also want to apologize for reading from the papers, so I apologize for that. So this panel will explore market entry strategies, shifting local regulatory, and the next big potential for growth. We also talk about the importance of creating and maintaining positive government relationships and how to navigate our markets while respecting cultural and regulatory nuances. So I want to introduce my friends here. Idan, founder of the Entourage Effect, one of Australia's leading warehouses of medical cannabis, also a former criminal lawyer turned entrepreneur, lucky you. Nacha is a pioneer in Thailand's cannabis sector, where she had helped shape the industry from its beginning. Also a COO of World Pharma Solutions and partner at Canogen. Merlin, over 2 decades in the cannabis industry, helped launch many Canadian and international brands. Also a director at, BizDev director at Carbon Extracts. And Omar, Chief Communications and Public Affairs Officer at High Tide, and with over 20 years of experience, including senior roles in government and public policy. Hello. So I want to start with the market entry strategies and asking you, what strategies or best practices have you found to be most effective for working in your evolving cannabis markets? And I want to start with you, Nache, as someone who is expanding businesses in Thailand, where cannabis market is evolving rapidly. Can you share some insights on how local culture and shifting laws shape your market entry strategies?
Okay, so beside heavy documentation, you have to also have the compliances from the very beginning. There will be a time that maybe you guys know for 2 years ago, there was, I call it Wild West area. That's going to come to a stop now. They're going to focus very heavily on the regulatory and compliances, and the government is supporting the pharmaceutical industry for medical cannabis only. So whoever that is not compliant right now, I would get it done very soon because the accountability is coming.
Merlin. Tell us about your perspective on working across international borders and the challenges it brings.
I think each market is unique. There's different challenges in each market. Compliance-wise and product-wise, different markets require different products, and there's different strategies. Some markets are lacking clients, some markets are lacking specific product categories, so it's really different in every market. So it's about doing your research into each country before you go in.
Idan. So until very recently, you know that Israel was the biggest medical cannabis market in the world per capita, of course. However, recently, I hear that Australia is giving us some fight on that title. So how can you explain, is it regulatory easements, or how do you explain that?
I think, from my perspective, human beings in general have shifted their treatment of conditions towards plant-based products as opposed to pharmaceuticals. And as a result of that, we're finding, at least in my market, that more and more individuals are taking medicinal cannabis as a form of treatment. In my market, it's only regulated for medical purposes. So, we went through a phase where, everybody's all about health, and there's a lot of people that went on to plant-based meat. And I think us as individuals, if you give me an option of treating a condition with something natural or a pharmaceutical, I'm probably going to choose the natural product. And I think, the world is evolving to a point where people are recognizing medicinal cannabis as a proper form of treatment. And so for various conditions. And so as a result of that, you're seeing a higher uptake, at least in Australia. I do know in Israel, because of the war, there's a lot of soldiers getting onto medicinal cannabis because of PTSD. And so we're using it to treat a range of conditions and not getting the side effects for it. So that's, from my perspective, why.
Thank you. Let's talk about governmental relationships. So regulatory environment can change in the blink of an eye, particularly in evolving markets. So I want to ask you, how do you approach building and maintaining strong governmental and regulatory relationship to ensure a stable operating environment? Omar, you've got extensive experience in governmental relations. What's your take on that? So
the first thing is that patience is required, right? Nothing happens overnight. So we at High Tide, just for those of you who don't know, we are the largest dispensary chain in Canada with 196 locations. I believe we're the second largest in the world now, actually, after Trulieve. But the way the market is set up in Canada is that the federal government regulates cultivation, but the provinces are in charge of distribution. So for a company like us, that means that in Canada alone, we're actually lobbying and trying to shape and influence regulations and legislation in 6 jurisdictions just in Canada alone. So you may have heard that we are looking at Germany as a potential market opportunity, both on the adult use pilot project side, but also on the medical import and distribution side. And it's something that we've been working at for 4 years now. So it's not something that you can just decide to do and get it done in a few weeks. We take the approach of proactively trying to help shape the policy and regulatory framework rather than just reacting to whatever the government may announce. And for that, the approach that we've taken, particularly here in Germany, is to find partners on the ground who understand the government, who understand the political dynamics of the country, who understand the culture of the country. So we've brought on companies like Pivot Strategies. We're working with Peter Homburg and Gunnar Cook on the regulatory side. Lisa Haag also as a medical advisor, medical cannabis advisor. So the first piece of advice I would have is find the right people locally who have the relationships, who can explain the various dynamics to you, and work with them and take their advice.
I can tell you that from my perspective, I make sure to keep very warm and very strong relationship with my regulator. I'm lecturing on his behalf in universities across Israel. I make sure to schedule occasionally a meeting with him. And I want to tell you that in Israel, our Israeli dangerous drug ordinance, we have a lot of legal loopholes. And I find it, of course, for the operators, it's disadvantage because lack of clarity, and certainly, but for me as a lawyer and from my legal perspective, I find it very interesting because I can put inside a lot of crazy ideas that I put on his table, and sometimes he even implement them if I have such a good relationship with him. So, Nacha, Thailand has been in the headlines recently for its rapid swings, moving from almost fully legalized market to what felt like a Wild West, and then to a strong regulatory pullback. From your perspective at World Pharma Solutions, how do you keep positive relationships with regulators to stay updated, to stay ahead?
I look at it as a marriage. We have to support each other because you have to, we have to be honest here that the market here in Thailand is just happened like 2 years ago when it first legalized. The government might not have the most experience like the other government in other countries, but we do have a lot of example around the world. And the Thai government is taking a step back right now. Yes, we did open a can of worms for the beginning. Yes, we are aware of that. But going future forward, now we have the stage that we are now, we are fully aware where we don't want to go. And that is the reason why it happened the way it happened last year, where you guys heard the headline that is going back to becoming narcotics. After speaking with the government and telling them that there is other option, it doesn't have to be like the cafe, cannabis industry, or like a more like recreational, because that's not the image for a Thai cultural Buddhist country to go with that image. And I think I speak for every Asian in the room as well. There's a big stigmatization that we're battling. We're just not battling stigmatization. We're battling with 60 years of very hard empowering people that believe cannabis should not be here at this moment. So a better way is for me is that I invite the government to my facility, World Pharma Solution. We have 2 facilities in Bangkok. And I show them, I welcome them to my home. I show them all my technology. I show what cannabis can do. I show that it's not just growing in your backyard. We can get in the pharmaceutical level. And when I show them all of this, they're more open. And I believe that that's how a good bonding, a relationship starts, by you showing them, educate them, and then take them on the ride of seeing what the possibility can happen. Because if you're trying to just do the business by yourself and leaving government behind, it's not going to happen. It's not going to end well. You need the support. It needs to go hand in hand. Yeah.
Talking about education and stigma, bad stigma. So cultural sensitivities. In certain regions, cannabis still carries strong cultural or social stigma. For example, in Israel, in my office, we run in our firm special cannabis conferences for the medical community. We bring scientists and experts, doctors and medical staff, and whole in-depth and educational conferences. So Marilyn, many how it works especially in Australia and Thailand, because I believe Canada is far behind the stigma, right? Or
There's
Still some stigma in
Still,
Canada.
there's
still some stigma, but I would say it's pretty mass accepted today. Just in the stats, we've seen a reduction in alcohol since legalization, so I'd say that adoption has happened, which has had positive effects across Canada for that side. But definitely there is some stigmas in business about the cannabis that you consume and when you would consume it, but as far as that goes, no, I don't think it's looked down upon anymore besides certain banks.
Well, I would say, just to jump in on Canada, there's still, to Natcha's point, within Asian communities, there's still a fairly high level of stigma there. It's been reducing since legalization, but it's still there, and it is something that policymakers and politicians remain cognizant of when making decisions on further legislative reforms.
They will build their whole entire campaign around that. Yeah.
So what do you do in Thailand or in Australia to cope with this? How do you break this stigma in Thailand or in Australia? Like it's medical market. And
So from my perspective, you try and make it more readily accessible to individuals in your country. The way we've tried to make it more readily accessible is by the use of technology, being able to We have a big telehealth market, pharmacy market, so being able to streamline it for the patient, being able to book appointments in an easy way, to see the doctor through the video, get the script, add to cart, checkout, click and collect. You make them, and everybody's treating some sort of condition, whatever it is, whether it's pain, cancer. So the easier you make it on the patient, the better results they get, and they tell their friends. And so the only way I see, and in Australia it's illegal to advertise, so you can't tell anybody here, come here and get your cannabis here. So the best way of advertising is word of mouth, and you give the patient a really good experience, they're going to tell their friends. Most of everyone in this room, I think, believes in medicinal cannabis, believes in its benefits. And so all of us, have heard stories of, my friend tried this, it worked really well, and then, becomes more and more accepted as a form of treatment.
Okay, the lawyer perspective. As a lawyer in the cannabis field for more than 7 years, I know how crucial it is to navigate compliance and regulatory challenges. So I want to hear how, even you, Idan, running mid-dispensary and the entourage effect in Australia puts you in the crossroad of patients, doctors, and regulators. What are the hardest compliance difficulties you are facing?
So you have doctors who have gone to med school for years, and no med school teaches you about the cannabis and how it applies. So education of doctors for my market is something that's absolutely critical. There hasn't been significant research, but obviously we believe in terpenes, and certain terpenes can be very useful for certain conditions. Getting that education out there to doctors so that way they have the ability to treat the patients. Once they are educated on the actual plant as a whole, will be in a better position to accept this as a better form of treatment than pharmaceuticals.
So, with respect to collaboration and partnerships, that's why we're all here. In order to promote success in our emerging or fast-evolving cannabis markets, it's very important to combine local insights with international know-how. We've just experienced a major regulatory shift in Israel that on paper should make exporting cannabis much easier, but still, practically day-to-day, regulatory and compliance questions make things progress very slowly. So that's why we place such value on cross-border relationships. It can optimize cost in production, packaging, marketing, and distribution, and accelerate growth, of course. Omar, how does High Tide engage with both local communities and policymakers to build partnerships that are not only commercially successful, but also align with regulatory and social expectations?
Yeah, I'll use a case study of something that we did in a municipality in Canada. But first of all, I want to thank Minister Smotrich in Israel for vetoing the tariffs on Canadian cannabis imports. Hopefully President Trump is paying attention.
Yeah, but you know that the Ministry of Economic ignore his decision.
Oh,
we keep going with the...
Incremental progress is good. One of the things that we did a couple of years ago in Canada was the way the law was set up in Canada's largest province, which is Ontario, was that it allowed municipalities to decide whether or not they were going to opt in to allow adult use cannabis sales. So the third largest municipality and a big suburb of Toronto, it's called Mississauga, for years had refused to opt into adult use sales. And that was a decision that was primarily being driven by demographic factors within the city. It does have a large South and East Asian community and population. And for years, the industry tried several times to convince the city council to allow the sale. 3 times it failed. And then finally, on the 4th try, about a year ago, it passed. It was successful. So why was it successful? So one, and this is something that we're seeing in the United States as well right now, Sometimes you just have to wait for certain politicians who might be a little on the conservative side and a little bit older to retire or be voted out. And that's what happened in the city of Mississauga. There was some turnover on the council, some new, younger, when I say younger, in their 40s, city councillors came in, and they obviously brought a fresh perspective to the table. We had identified certain swing votes on the council as well. And what we did is we spent some time to figure out what their pressure points would be, and we realized for 2 of those swing votes, they were really worried about the illicit market, particularly the expansion of illegal bricks and mortar dispensaries. So we worked with them on to bring them together with the police services locally to build a plan on how to enhance enforcement and drive some of those brick and mortar dispensaries out. But in the process, we were able to switch their votes. And then finally, we invested time, money, and energy into community outreach into those Asian communities, South and East Asian communities, to educate the parents, to educate the community leaders that the world is not going to end. Your children are not going to be smoking more cannabis. We actually pointed out the fact that youth cannabis consumption in Canada is down since legalization. We didn't win all of them over, but we were able to mitigate some of the opposition that way. And it all culminated in the city council, again, after years of effort, coming together and allowing sales within the municipal boundaries. And this is a municipality of 1 million people that now, because of proactive lobbying, is allowing cannabis sales there. And High Tide has half a dozen stores in Mississauga, Ontario, if anyone's ever there.
You know, I heard of a new phrase for recreational or adult use, sub-medical market.
Sub-medical market,
Nice.
That's interesting.
Right? So, Idan, please tell us from your point of view, how do we foster global partnerships that bring together local expertise and international capital?
That's a tough question. I mean, for me, I think that to bring everybody together, I'm a big believer in technology. I think that the use of technology is a big driving factor, and for our technology stack, the Entourage Effect, it took 2 or 3 years to develop, and eventually we hope to release that technology stack in other markets, and it's a technology stack that we give away for free. We don't charge people for it. We don't charge per unit. It's kind of like Spotify. It's just free. And so hopefully we can get a high adoption rate amongst it, effectively give patients throughout the world a really good experience, whether you're in Thailand, whether you're in Canada or Europe. That will effectively lift the entire market as a whole and effectively lift the operators in the individual markets. So from our perspective, we say technology is the answer.
So let's talk about growth and investment opportunities. One of the most dynamic aspects of the cannabis industry in our markets is the significant potential for growth and investments. So Marilyn, you've been part of Carbon Extract. It's a company that has scaled up significantly. We all know that Canada is a huge market, but from your point of view, as someone with a lot of experience in global corporations, where do you see the greatest area for growth or investments in emerging markets? And also please address where do you see the oil segment headed over the next few years?
That's a stacked question, thank you. I would say that the biggest, in my opinion, because that's what we mainly focus on is hydrocarbon extraction at our site in Ontario. I believe that extracts are kind of the future, well, not the future, but a carved out segment that not many people have kind of looked at. And I think they're more pharmaceutically aligned products because there's repeatable outcomes every time with it. We can make the same product. We don't have variability of growing and flower changing. Also, dried flower doesn't really give you doesn't give you the same effect every time, right? It can be one cultivation can grow 2 crops and be completely different. So with extracts, we can have really repeatable outcomes on that side. So I believe that extracts will have a huge place in the medical market in the future. Right now, it's really been flower-based, in my opinion. And you know, there's fats, waxes, plant matter, tars, everything like this in dried flower, and that's why I think oils will have a larger place.
And of course, it's different between the medical community and the recreational.
Yeah, in the recreational market in Canada.
Only flowers, right?
No, it's not only flowers. I would say that 50% of the market is dried flower. And we're seeing, you know, it's ease of use that really changes the market here. You know, we see pre-roll segment growing drastically just because you.
It's our second biggest segment in our stores is pre-rolls.
Yeah, exactly. And as far as extracts goes, the biggest portion of extracts in Canada has to be in the vape segment, and that's also ease of use, same as a pre-roll. However,
Third biggest segment.
There you go.
In Israel, it's 95% flowers.
Yeah. And that's just because I don't think the accessibility and the knowledge to doctors is there yet. I think extracts will be used as a harm reduction tool in the future. Let's say you're prescribed 250 milligrams to a patient in a day. They have to consume 1 gram of flour, which would be in a mighty 5 of those little pucks in a day, where the same amount of milligrams could be administered with just 1 puck of an extract. So, you know, if you're consuming 1/5 of the amount, it is technically a harm reduction tool.
We still need to get confidence in the vapes, you know, in the medical devices, the delivery system, because the vape aren't.
Yeah, I agree with that. There is no medical device cartridge yet on the market. However, like Mighty and Volcano, which are the stores in Bickles, do have extracts, little
CE, yeah.
Yeah, exactly, that you can use and administer like that, and it's been super efficient and easy for customers to use, or not customers, patients.
Can I say this? I completely agree with everything Merlin said. In my market, at least in Australia, extracts are growing quite well. There are a lot of sophisticated people out there. I mean, some of us have kids. We can't be, you know, bringing out flour, rolling, you know, joints up in front of our kids. So for a lot of us who are sophisticated, we're choosing that form of a delivery method because it's discreet. I don't have to have a tray, scissors. There's no, you know, big, mission in order to take my medication. I can go outside, I can draw a couple draws from my extract, and I can come back in, and nobody knows better. And so for a lot of people, they're choosing that form. It's also like in my market, gummies are really, really growing because, you know, a couple years ago, you would only take a couple drops of oil. So people would rather take a gummy than take oil. And you're seeing that segment of the market growing. So, you know, I agree with you. The extracts, I think, are the future for a lot of people.
I agree. Nacha, a lot has happened in the Thai cannabis market from inception to nowadays. Tell us about that, please, and feel free to elaborate on your experience, especially with respect to import and export issues.
Could you ask the question one more time? Sorry, I zoned out.
So just, can you tell us about export and import issues, compliance issues, and...
Touchy subject. Better to talk private. I will share you whatever that's public information, okay? I mean, so the Thai market is quite small for, I would say, for the just relying on the local market. That is the reason why more people, more facility company is looking for the export market. I'm gonna break it down to you guys on these different sectors so you guys understand. So there is a lot of compliance farm that obtain the GACP farm, probably about 30 farms, but you have to break down from that tier down to here, who is still upholding that standard, and breaking that tier to the 10 people farm who have done successfully exporting and know how and actually have all the documentation order. Then we're narrowed down to just 5 farms at the moment. Very easy to find out. It's all public information. 5 farms that has done, and there's public information about it. So that's why I only want to speak about the stuff that you can see on the website of the government and stuff like that. Anything else, I don't know. So yeah, they have GACP, they have everything that you would require from the export. I heard recently, just a few days ago, there is a shipment coming. It's stuck because their documentation was wrong because they didn't put one word, I forgot, medical. They had cannabis. They did not put medical cannabis, so it stopped. And what happened is that it got sent back, and time is valuable. Now we're curing the flower, I guess, along the way, and then, so this is what I'm saying. There's a lot of things that hasn't been written down for the regulation to this process. I urge Thai government to do so and work with the jurisdiction in that country so we have a clear guideline, so that way we don't have this kind of silly mistake with just one wording and costing us tremendous time and money. Yeah.
I also know that, for example, I had a client that asked to bring cannabis from Thailand, medical cannabis, because Israel, it's only a medical market, but we try to bring medical cannabis from Thailand to Israel, to import to Israel, and we don't have a relationship, a G2G relationship with the Thai government. And I'm asking, do you working on that? Like, do you have relationships G2G with other countries, with Canada, with Europe countries?
So I think a lot of people know that Thailand doesn't have a government body association right now within the cannabis like everyone else. We need that.
And the Ministry of Health in Thailand?
Yes, but there is not one dedicated person or sector. I would probably talk to the government some more after information I've learned today from the German jurisdiction and the personnel that advised me. It cannot come from a private sector. Like, the government cannot say, oh, by the way, you have an association, I'll give the job to you. And you do the homework, and then you be the person for Thailand. It needs to come from government. So if a government needs help, or need someone to hold their hand in the process, it needs to come directly from the government. So that hasn't happened yet, but is in the working process. Once we have that, we're definitely moving forward. Yeah.
Good to know. So how much time we have? Okay, so with that in mind, with all that in mind, let's close with an optimistic outlook. So I want to ask all of you, each one is in his turn, what breakthroughs or developments do you expect will shape the cannabis industry over the next 10 years or so? And in your view, what needs to happen, whether in the regulations, science, or business, for us to be in a significantly better place by then? Let's start with Merlin. And
Okay. I would say breakthroughs that are upcoming will probably be like dosage formats and devices that'll be more medically inclined to consume cannabis products. And then along with that, more testing so we can actually have some research to back our stuff up. We've been doing this now for quite a while with minimal research available that we're actually allowed to tell patients. So I think that's it. And as regulatory adapts in new countries and emerging markets, I think that's really going to be the changing factor for us.
I truly believe that Thailand's going to become for the hub for Asian, for exporting. I truly believe that because we're already in it at this moment. And if my calculation is right, that I have done the database, it will increase the GDP of Thailand by 3% the first year. And government loved this number when I presented to them. But we still have a few steps to take before we get there. Right now, we have to get the compliance in order, the jurisdiction, and then once we have that, I think the accountability start. So everyone knows that, oh, you guys do have already jurisdiction and everything and compliance is in order. I say, yeah, we do, but we don't have, there's no penalty in place on force yet. I mean, you might see in the headlines that says, that, oh, this dispensary closed down or anything, but it wasn't closed down to how do I say it, because it didn't follow the guideline or anything, but there might be some illegal activity on the shop front. You said you sell cannabis, but how come we're finding something else, you know? But there needs to be a clear accountability. That way people kind of get scared, because now we have the rules, but everyone is not following the rules because there is no real accountability. I have yet to see anyone get thrown in jail, you know, for breaking the rules or laws. Yeah.
So I'll be quick because I know there's only 2 minutes left. So if we're talking about a 10-year time horizon, I think particularly if the German and Dutch model projects prove successful, I think we could see further rollout of model projects across other European jurisdictions, and then potentially a loosening of some of the restrictions at the European Commission level on adult use. In the United States, I think we're going to continue to see demographic turnover in Congress. On a 10-year horizon, I think it is quite possible, again, on a 10-year time horizon, to have a Congress in place that could vote potentially for federal legalization, and to have a president in place that would sign that bill. Again, 10-year time horizon, folks.
If we're talking about 10 years, I genuinely believe in about 10 years, medicinal cannabis in Australia will be legalized recreationally. Unfortunately, that would destroy my business, but that's the reality of the situation that we're in. As the stigma gets broken down in Australia, as people realize that cannabis doesn't lead to increased death on roads, etc., it then becomes more socially acceptable as a form of treatment. Once you get a significant amount of the population using it as a form of treatment, then effectively it'll eventually be legalized recreationally in a similar way than California. It just became so easy to get a prescription that they just said to everyone, we might as well legalize it recreationally. And they had the data for years and years to prove it didn't, you know, increase death on roads and other things that we as a society must, you know, feel comfortable with before we allow it to be recreational.
So my too optimistic stand, having said all that, I foresee the global cannabis industry becoming bigger than both tobacco and alcohol industries. This is maybe 10 years or so. And it's clear that it's a question of if and not, it's not a question of if, it's a question of when. So thank you, everybody. Thank you for listening.
Thank you all. Let's hear it once again for all our wonderful panelists. And I would like to give you an extra special thanks for staying within the time constraints.